Hi. The beautiful Oya is here again. So today we are going to do administration of suppository, alright? So let's assume that my patient is already here. My patient is here. And this is my hand gel. So let's assume that all checks have been done. So I pour an amount of hand gel into my palm. Palm to palm. Palm over dorsum. Vice versa. Fingers interlaced. Fingers interlocked. Thumb rotating, fingertip rotating, fingertip rotating. I do it for 30 seconds, allow it to dry for 30 seconds, and I assume my 30 seconds has passed. I'm happy to approach my patient. So, hello, I'm Abuna, one of the nurses taking care of you today, or assigned to take care of you today. How would you want me to call you? Annie. Okay, Annie, I'm here to administer your prescribed glycerol suppository as directed by doctor today at 1200. This is because you've been complaining of constipation. So this is the laxative. This is going to help free your bowels. Is that okay with you? Alright, so some of the potential side effects of this glycerol, you may have a loose stool and irritation of your rectum. Is that okay? Are you comfortable with that? Alright, so just to let you know that we will have to do a first ID check with you. Okay, since the medication. So I'm going to do this against your wristband. Okay? Alright, so could you please help me with your full name and date of birth? Annie Smith. So Annie Smith, date of birth 1974. Okay, 1190, that's right. Also number 004382. So 004382, right? Do you have any allergies? No, I can see you don't have any red bands, so that's okay. So I can confirm this is the right patient. So I'd like to give you some few instructions before I go and prepare the equipment and the drug. So please, there's a commode, there's a bedpan and toilet facilities here. In case you want to use it before the procedure, can you let me know? I also want you to lie on your left lateral side with your knees flexed and your feet slightly raised with your buttocks near to the edge of the bed. Is that alright? Are you okay with the instruction? Okay, so I'm just nearby. I'm going to prepare the medication. In case you need me, just call my name. I'm just nearby. Is that okay? Alright, so I perform hand hygiene again. Okay, examiner, I can confirm that my tray and trolley is clean and ready to be used. Examiner, can you confirm whether it's been cleaned for the past 24 hours? Alright, so I have my apron and my glove, which is clean and intact. I have the incontinence file, which is clean and intact. Examiner, can you confirm whether it's in date? Okay, I have my gauze here, which is intact. Expired date is 15 September 2029. I have my lubricating gel here. I'll be using this as a lubricating gel. Expired date is 7 March 2026. Then I have my glycerol here, which is intact, not exposed. Expired date 10 March 2029. So I'm going to read a prescription. So this is a prescription for Annie Smith. Date of birth 11/1934. Number is 004382. Patient weight is 53 kg. Patient is at the medical assessment unit. Patient has no drug allergy. The drug answer once only medicine, pre-medication, antibiotic prophylaxis, and patient group direction. The first drug is glycerol. Date is today. Dose is 4 mg. Route is per rectum. Time required is 1200. Prescriber signature bleep present. Pharmacy check. So I can see this is a valid prescription and legible one. So I'm happy to use it. So this is glycerol. The dose is 4 mg, which I can see on here. It's per rectum, as I can see, and it's not exposed. Yeah, so this is glycerol in 4 mg, and I'm happy to use it. So I perform a hand hygiene, then approach my patient. So hello, so let's assume my patient is already in that position. Hello, Annie. I'm about to start the procedure. It's okay. Don't worry, I've already provided privacy and dignity by pulling the curtains and closing the windows, so I'm not going to be too exposed. Is that okay? Alright. So I've already performed my hand hygiene, and I'm doing my PPs. Okay, so before we start the medication, I'll have to do a second ID check. Examiner, since this is a hospital setting, would you like to do the second ID check with me? Okay, so this is, Annie, can you please help me with your full name and date of birth? And estimate that's correct. This over 174. Now 174, that's right. Also number is 004382. 004382, that's right. Do you have any allergies? No, I can see you don't have any red bands, so you are not allergic to anything. Alright, so I can assume this is my right patient, so I'm happy to proceed. So I'll read the prescription. So the drug is under one solely medicine pre-medication, antibiotic prophylaxis, and patient group direction. The first drug is glycerol. The date is today. Dose is 4 mg. Route is per rectum. Time required 1200. Prescriber signature bleep now present. Pharmacy check. Examiner, I can confirm that this is glycerol. The dose is 4 mg, which I can see here. The route is per rectum, and that's right. So I'm happy. This is a valid drug, the right drug, and a valid prescription, the right patient. So I'm happy to proceed. So I'll perform my hand hygiene again. And on my gloves. So I'm going to place the incontinence pad between the patient's hips and buttocks. Okay, so I'm going to observe the patient's inner region for any soreness, swelling, excoriation, rectal polyps, hemorrhoids, infestation. I can see there's none, so I'm happy to proceed. Okay, so I'm going to take the gauze, place some of the lubricating gel on it, then lubricate my suppository glycerol. Okay, good. So let's say I've done that. Now I'm going to part or separate the patient's buttocks. Okay, and instead of suppository using the correct end according to the manufacturer's instruction, advancing it approximately 2 to 4 centimeters. Okay, good. So I'm going to insert it 2 to 4. Are you comfortable? Are you okay? I'm very sorry. So let's say you've inserted it about 2 to 4 centimeters. Okay, good. All right. So examiner, since the dose is, sorry, is 4 mg and is 1 suppository, I'm going to end that. But if there were additional suppositories, I would have repeated the procedure again. But since it's just that one, that's okay. So I'm going to clean the excess lubricating gel that came out of the anal using my gauze. So I clean the anal region, discard it, and clean the inner region and discard it. Alright, so I'm finally done. So Annie, I'm going to ask you to remain lying down for the suppository for about 20 minutes for the suppository to retain your rectum, okay, until you are no longer able to do so. I'm also going to inform you that you might experience some discharges from your inner region, which is normal. Is that okay? Alright, don't worry. There's bedpan, commode, and toilet here. In case you want to use it, let me know and I'll be here to assist you. Are you comfortable? Do you want me to assume you into a comfortable position? You want me to? Okay, so let's assume that I've done that. I'll take this off. So let's assume I've done all that. Okay, so I'm going to leave. In case you need anything, just use a cover. So let's assume I've covered my patient up. I've covered my patient up. Are you alright? Are you comfortable? Okay, so I'm going to take my leave. In case you need anything, just use a cover, okay? So I discard all used items, the clinical waste. And ensure that my tray and trolley is clean and ready for the next use. Okay, then I perform my last hand hygiene according to the WHO standard. So palm to palm over dorsum, fingers interlaced, fingers interlocked, thumb rotating or fingertip rotating, thumb rotating, thumb rotating. I do this for 30 seconds. Allow it to dry for 30 seconds, and I assume my 30 seconds has passed, and I'm happy to approach my patient. Thank you very much. If you want me to do another procedure that you find difficult to do, let me know in the comment section. All right. Watch out for the next video. There is a next action. See you next time. Bye. Bye.